And it is one of the most common cancers in the U.S. This year, nearly 85,000 people will be diagnosed with bladder cancer. And in honor of Bladder Cancer Awareness Month, we invited Dr. David Freeberg, a urologist from St. David's Round Rock Medical Center, to join us today on Midday to talk about that. Welcome, doctor. Thank you so much for joining us.
Thank you for having me.
And so one of the biggest challenges to bladder cancer's diagnosis is recognizing the symptoms. So walk us through, what are the signs we need to look for?
Sure. One of the early signs may not even be visible to the patient. So if they're getting a urinalysis from their primary care physician, and that may show a small amount of blood in the urine, and that can be an early tip that something's going on. Certainly if you see blood in urine, then that's really concerning, and you should see a urologist promptly. But there's other things that can be...
Pardon us.
I'm sorry.
You are a doctor, and you're very important. We understand that. That's
can
okay.
you guys take this? Yeah. So the other symptoms you can have are frequency of urination.
Okay.
Yeah, and also urgency, where you have to go quickly and without much notice. And then sometimes pain in the lower abdomen area. Those can be symptoms.
So what symptoms are often mistaken for other conditions of the ones you just mentioned?
Right. Sometimes a lot of those frequency, really all of the ones I mentioned, could be urinary tract infection, and that may be as simple as it is. But it could also be a harbinger of bladder cancer, so it's important to seek attention. Yeah.
So according to the National Cancer Institute, bladder cancer is most likely to affect white men and is 4 times higher among men than women. What are the risk factors? Why is that?
Well, perhaps some of the risk factors are being around smoking. Men are more likely to smoke, and they can also occupational exposures to various chemicals. There could be there's a number of industries that there can be some carcinogens exposure. And that's most likely, plus men are less likely to drink fluids and empty their bladder frequently.
They don't drink enough water.
That's right.
I tell my husband and son that all the time. All right, so let's talk about, if you'd like to support the Austin Walk to End Bladder Cancer. That event is this Saturday at Peace Park. It starts at 10 a.m. And there it is. And doctor, you said some members from our hospital will be there.
Yes, in the hospital. Yes.
There you go. Anything else we left out, Dr.?
No, I think the one thing I would say is early detection can make a real difference in how effectively we treat it and survival. So
there you go.
It's key to get early diagnosis.
Dr. David Freeberg, we appreciate your help.